Hi, welcome to Healthy Kingston, a program brought to you by the Kingston Board of Health. My name is Janet Wade, and I'm your host. For the next 30 minutes, we'll be talking with Paula Rossi Clapp, our health agent. She's going to be updating you on what's been going on in the health department, and I'm sure most people are interested in knowing what's going on with the new immigrants and refugees that are residing in the Baymont Hotel here in Kingston, and she'll be giving us an update on that. Followed by some presentations by Massachusetts General Hospital Institute for Health Profession nursing students who've been working here in town, and I'll tell you a little bit more about them in a bit. But first, my interview with Paula Rossi Clapp. Paula, very nice to have you here. I know you've been very busy, so thank you for your time. We appreciate it.
Not a problem, Janet. Thank you for having me. I like to do these updates with you when we can.
Absolutely. So tell us right now, what's generally going on in the public health department?
So the Board of Health Department has been going through some internal changes with the addition of our new administrative assistant, Lori Jones. She started on October 31st, and she's quickly getting adapted for sure. Everyone can meet her at our next board meeting. That's Monday, November 7th, and I'm sure that you'll have her join you here on the show when she gets a little more comfortable in her new role.
Absolutely.
She's very excited to be here, and I'm very excited to have her. So the public will enjoy meeting her. As for my duties, I have been busy with construction site inspections and organizing the department needs. We're beginning the fiscal year 2024 budget process, and we will also be adding some senior tax helpers within our department beginning in December, and they'll be helping us upload thousands of pages of construction permits, as-built plans, and Title V documents so that we can easily provide the public with document requests and quick access to online emailing them these documents. So we're also in the process of working with the town to implement their new software program so that the public can not only apply online, but also make payments. This will most likely not roll out until 2023, but we're in the process of working on it. I know a lot of towns have gone electronic, and Kingston will be joining that group. Another topic of interest the Board of Health will be working on this year is the new amendments to the Title V regulations from the Massachusetts Department of Environmental Protection to enhance protection of embayments and estuaries regarding the nitrogen levels emitted from septic tanks and sewer treatment plants. So the Mass DEP is providing information through their website and holding public hearings beginning in December. So for those of you interested in learning more, they should go on to the Mass DEP website. A new plastic bag ban program will be implemented and monitored under the department as well. And an update and more details will be coming from our board chairman, Joe Kasna, at our next board meeting. So people can tune in for that. My understanding is that the Board of Health will be leading in the promotion and public education piece. But again, more details are coming from Joe. I have questions about the Baymont Hotel situation. So I want to give you my latest update on that. And the new migrant residents in town. On Tuesday, November 1st, I was made aware that there are currently 36 families totaling 136 people. 59 are adults, 39 are school-age children, and 38 are non-school-age children. For the Board of Health oversight, we've inspected the hotel as well as the rooms as part of the housing code. And we've also inspected the pool and the function room, dining hall, and everything is up to code and in compliance regarding housing and food codes. We'll continue to monitor that on a regular basis. The public health nurse under the Board of Health is also involved. And Janet, you can speak more of how you, along with the Mass General hospital nursing program has been involved with helping with the intake and assessment process over there. As for public assistance with donations, from what I know, the public has been very generous. If you would like to donate, please contact the Board of Health office at 781-585-0503, and we can give you the number of the on-site agencies. One of the agencies is Neighbor Works, who is the lead agency from the Plymouth area. For Plymouth. And the other agency is the Plymouth Area Coalition, who is the lead agency for Kingston. And I can say that Suzanne Giovanetti and Joanne Camara, along with 2 case managers, have been doing a great job with the organization and health assessment process at the Baymont. They've been there from 8 a.m. to 6 p.m. every day. And I've been informed there's been some challenges with translation services. And that's making the assessment process take a little bit longer, but that's being resolved. And about 25% of the migrant residents do speak English. So as for donations, they are asking only that you do not donate fruit or milk, as there is no appropriate storage at this time for those items. And I just want to mention one last thing, and then Janet, if you have questions for me, I just want to remind the public that to not let their guard down regarding ticks this year. We still have not had a complete frost, and this weekend's mild weather is going to keep the ticks alive and very hungry. So keep checking yourself for ticks and your pets. So until we get a complete blanketed frost, it's still a warning out there for ticks. So that's my end of it, Janet. And again, thank you for having me. And if you've got any questions, I'd be more than happy to answer.
Absolutely. Wow. I mean, I knew you were doing a lot, and I'm overwhelmed at hearing all you are doing. And I thought I knew everything you were doing. Yes, as far as everything going on at Baymont, I have to extend my personal appreciation to not only the health department, but the town in general. People have been tremendously generous and very receptive to the needs over there. I know I originally reached out to the Haiti 180 people that I went to Haiti with on 2 medical missions. They are out of St. Joseph's and St. Mary's Collaborative, and they were certainly very receptive, particularly in the area of food. The Unitarian Universalist Church and the Beale House have been taking donations of clothes and other items, which have been very much appreciated. And I understand the Vineyard has been helping with food and items as well. So much thanks to the churches. And if I've omitted any of you, I apologize, but those are the 3 that I've heard of. I do find that the people are very cordial. They're very much appreciative of all that's being done for them. They're nervous, they're scared, which is very understandable. And we're anxious to get the children into school, those that are school age. There are 79 children there. Brand new babies, baby was born right as they were going into the hotel, and another one is due to be born momentarily, and like a lot of little children. So your efforts are very, very much appreciated and reflect very well on the Kingston area. So again,
Janet,
Kingston cares.
You also, I want to give you a shout out. You have taken the lead from the board, as well as brought in Leanne McGinnis, the town nurse, and the 2 of you have been instrumental in being there at their service at every moment. You really have. I mean,
well, thank you
a lot. Yeah.
Thank you. Fortunately, there haven't been too many things that have been overwhelming. A couple of people with high blood pressure, the woman who thought she was going into labor, that had to go to the hospital, some coughs and colds and flus and letters to the school for kids going back to school, this type of thing. But thank you, I appreciate it. And again, Leanne is always there, our public health nurse. So Johnny on the spot there.
Yep.
Okay, so again, thank you, Paula. Really appreciate the update.
Yes, no problem.
Take care.
Anytime, anytime.
Okay,
So,
all righty,
thank
thanks.
you. All right.
Now I'd like to give an update from Leanne McGinnis, our public health nurse, who would like everyone to know that there are currently, and this is as of November 3rd, 39 cases documented of COVID in the town. Of course, we know there are many more, but those have been the ones that have actually been tested and sought help and are in our public health system. Next, I would like to introduce you to some nursing students. They're in the Accelerated Bachelor of Science in Nursing program at Massachusetts General Hospital Institute for Health Professions. And they are going to be giving you some general information on basic health topics of interest to all of us.
Hi, everyone. We are a group of students from the MGH IHP, and we're just here to talk a little bit about some of the common concepts we've been learning throughout our ABSN program. My name is Kendra Lippert, and I will be talking about lung cancer. So lung cancer is one of the leading causes of deaths in the US, and it's also known as bronchogenic carcinoma, which is basically means that a bunch of tumors are developing within the lungs. It's estimated that there are about 225,000 new cases of lung cancer in the US every year, and approximately 160,000 people die each year because of lung cancer. Within the last 20 years, lung cancer deaths have been on the rise, which is mostly attributed to the increase in smoking among both males and females. The main causes of lung cancer are tobacco use. This is the primary cause in both males and females. The effects of cigarette smoking on the lungs are fatal. And at this time, there are about 1.1 billion smokers worldwide. Some other causes of lung cancer include secondhand smoke, living in the home with someone who smokes, air pollution, chemical exposure, lung disease such as COPD, and radon exposure. While lung cancer still occurs in those who have never smoked, the chances are significantly increased in those who do engage in smoking, especially over a long period of time. Some signs and symptoms to look out for. Lung cancer is challenging to diagnose in its early stages as it presents itself as any typical respiratory symptoms, including cough, chest pain, shortness of breath, wheezing, unexplained weight loss, increased fatigue, and coughing up blood. It's important to see your healthcare provider if you have any of these symptoms, especially if you have a history of smoking. And lung cancer can be diagnosed with either an X-ray or a CT. And then lastly, I have some tips for prevention of lung cancer. First of all, it's best to avoid smoking or stop tobacco use if you've used it in the past. Avoid secondhand smoke, carcinogens, or toxic substances in the work environment. Test your home for radon and eat a healthy diet and exercise regularly. And lastly, when to call your doctor. If you're experiencing any of these symptoms persistently or are a smoker who has been unable to quit, it's a good idea to consult with your doctor who can recommend strategies for quitting, such as counseling, medication products, or nicotine replacements.
So my name's Erin. I'm going to be talking about chronic obstructive pulmonary disease, commonly known as COPD. So what is COPD? The CDC refers to COPD as a group of diseases that cause airflow blockage and breathing related issues in people. The two most common types are called emphysema and chronic bronchitis. 16 million Americans have been diagnosed with COPD, but many more have gone undiagnosed and untreated. It can be caused by tobacco smoke, exposure to air pollutants, genetic factors, and respiratory infections. Typical symptoms include frequent coughing or wheezing, excess phlegm, mucus, or sputum production, shortness of breath, and difficulties taking in a deep breath. So for diagnosis and treatment, this is diagnosed by tests used to measure the function of the lungs called spirometry. This is a simple test to perform and can detect the disease in any person who has breathing problems. Unfortunately, there is no cure to this progressive disease, but there are different treatment options. Some things that you can do to slow the progression of COPD would be to avoid smoking and other air pollutants. There are also many medications used in combination to treat the symptoms of COPD. These include bronchodilators, anticholinergics, and in case of worsened illness, steroids, mostly seen in the forms of inhalers. Supplemental oxygen is also used to keep up with the body's need to circulate oxygen. So smoking and COPD, although some of the risk factors of COPD include genetics, there are some modifiable risk factors to prevent this disease or slow its progression once already diagnosed. Smoking is the leading modifiable risk factor to causing COPD, meaning it is a choice that someone can make to prevent this disease from progressing. Tobacco smoke repeatedly injures and remodels the cells that make up the airway, resulting in increasing the inflammatory process that causes this disease. Quitting smoking is one of the most important choices a person can make to prevent COPD and its progression. Thank you.
Hi everyone, I'm Hannah, and I'm just going to talk a little bit about diabetes. Diabetes is a chronic health condition defined as high blood sugar, hyperglycemia. High blood sugar is also known as glucose. This condition causes your body to be unable to produce insulin or enough insulin to break down the glucose in your bloodstream. Overall, this results in high levels of blood sugar. Insulin is a hormone that the pancreas produces to manage your blood sugar. Insulin determines the amount of glucose allowed into the cells to make energy. There are two types of diabetes. Type 1 diabetes is when your body either produces very small amounts of insulin or none at all. Since there is not enough insulin, the glucose is not able to enter the cells, resulting in elevated blood sugar levels. Common symptoms of type 1 diabetes include increased thirst, urination, and hunger. Some risk factors include family history and genetics. Although type 1 diabetes can occur at any age, ages 4 through 7 and 10 through 14 are common ages it may appear. Complications of type 1 diabetes can impact your heart, blood vessels, nerves, kidneys, eyes, feet, skin, mouth, and pregnancy. Heart and blood vessel complications include chest pain, heart attack, stroke, atherosclerosis, hypertension. Nerve damage complications include tingling, numbness, burning, pain, nausea, vomiting, diarrhea, constipation, and erectile dysfunction. Kidney damage can include kidney failure and irreversible end-stage renal disease. Eye damage may include cataracts, glaucoma, diabetic retinopathy, causing blindness. Foot damage can result from nerve damage and poor circulation to the feet, resulting in cuts and blisters. If these were to be left untreated, significant infections can occur that result in amputation. Some skin and mouth complications include gum disease and dry mouth. There is an increased risk for preeclampsia, gestational hypertension, diabetic ketoacidosis, miscarriage, birth defects, and stillbirth with uncontrolled diabetes during pregnancy. Treatment of type 1 diabetes includes insulin medications, monitoring your blood sugar, maintaining healthy eating habits, regularly exercising, counting carbs, fats, and proteins. The goal of the treatment is to keep blood sugar level as close to normal as possible. Type 2 diabetes is when there's not enough insulin produced and cells poorly take in glucose, resulting in elevated blood sugar levels. Symptoms are similar to type 1 diabetes, including increased thirst, urination, hunger. Additional symptoms are blurred vision, slow healing sores, frequent infections, and numbness or tingling in the hands or feet. Some risk factors include obesity, overweight, decreased physical activity, family history, and high cholesterol. Complications are the same as type 1 diabetes with the addition of sleep apnea, hearing impairment, and dementia. There is no way to prevent type 1 diabetes, but there are some ways to prevent and treat type 2 diabetes, including eating healthy, exercising regularly, and losing weight if necessary. Blood sugar monitoring, medications, and insulin are also interventions that may be involved in the treatment of type 2 diabetes. Emergency complications of hyperglycemia include diabetic ketoacidosis, also known as DKA, or hyperosmolar hyperglycemic syndrome, also known as HHS. DKA is more commonly seen in individuals with type 1 diabetes. DKA is an increased buildup of ketones in the bloodstream due to your body breaking down its own fat for energy. Symptoms are excessive thirst, increased urination, nausea, stomach pain, fatigue, shortness of breath, fruity scented breath, and confusion. HHS is more commonly seen in individuals with type 2 diabetes.
HHS is when the blood glucose levels are extremely high for an extended period of time, causing dehydration and confusion. Symptoms are confusion, dry mouth, excessive thirst, increased urination, fever, and blurred vision. Treatment for both DKA and HHS include intravenous fluids, electrolyte replacement, and insulin therapy. It is important to contact your provider if you're experiencing any symptoms of diabetes. If you have diabetes and are experiencing any mild symptoms of DKA or HHS, it is important to contact your provider. If you're experiencing serious symptoms of DKA or HHS, it is crucial to call 911 as these can be life-threatening conditions. Thanks.
Hi, my name is Hailey. I'm going to be talking about HIV and AIDS. So HIV, or human immunodeficiency virus, is a virus that originated in Central Africa that attacks the body's immune system. And then AIDS, or acquired immunodeficiency syndrome, is the result of untreated HIV. Because there's no definitive cure for HIV, once a person is infected with the virus, they have it for the rest of their life. HIV can be controlled with proper medical care, and these individuals who seek treatment have the potential to live long and healthy lives. Knowing how HIV is and is not transmitted is important in protecting yourself and others. HIV can be transmitted by sexual contact, sharing needles for injectable drugs, and during pregnancy, birth, or breastfeeding. HIV cannot be transmitted by air or water, saliva, sweat, tears or kissing, insects or pets, and sharing toilets, food, or drinks. To protect yourself from HIV, get tested at least once or more often if you have increased risk factors. Use condoms correctly, choose activities with little to no risk. Do not share needles, syringes, or other injectable equipment. Most individuals with HIV have flu-like symptoms such as fever, sore throat, swollen lymph nodes, rash, muscle aches, night sweats, mouth ulcers, chills, and fatigue. However, having these is not diagnostic of HIV, and other illnesses can also cause these symptoms. On the other hand, some individuals have no symptoms at all, and the best way to find out if you do have HIV is to get tested. There are 3 stages of HIV. Stage 1 is acute HIV infection, stage 2 is chronic HIV infection, and stage 3 is acquired immunodeficiency syndrome, which is also known as AIDS. During stage 1 acute HIV infection, individuals infected have large amounts of HIV in their blood and are highly contagious. Most individuals have flu-like symptoms during stage 1. During stage 2, chronic HIV infection, individuals are most often asymptomatic, which is also referred to as clinical latency. Although individuals may be asymptomatic and not become sick, HIV is still active and reproducing in the body, which means this individual can still transmit the virus to others. At the end of stage 2, the viral load, also known as the amount of HIV in the blood, increases, which can lead to stage 3. Stage 3 is the most severe stage of infection. Once in stage 3, the individual now has AIDS, which has an even larger viral load, causing an easy transmission of HIV to others. Those with AIDS have extremely damaged immune systems. This means they can contract many infections and serious illnesses. The survival rate of an individual with AIDS without HIV treatment is usually about 3 years. And then lastly, if you believe you have been exposed to HIV, it's important to contact your healthcare provider right away and get tested to ensure early treatment if necessary. Thank you.
Hi, my name is Faith, and I'm going to be talking about influenza and the influenza vaccine. So influenza, or commonly known as the flu, is a respiratory illness that is very contagious. It is a viral infection that affects the nose, throat, and lungs. The virus travels via the air when infected individual sneezes, coughs, or talks. It is typically self-limiting, meaning that with time, the symptoms will go away on their own. Although there are cases where the flu can be severe enough for complications to occur. It is important to note that individuals are contagious from 1 day before symptoms arise to 5 days after they begin. People that are at highest risk of developing the flu include young children, typically under the age of 2, and older adults. Other people who are susceptible are people with weaker immune systems and or chronic illness, residents of long-term care facilities, and school-age children. Common signs and symptoms of the flu typically include a runny or stuffy nose, fever, sweating, sneezing, coughing, muscle aches, chills, and sore throat. High-risk individuals, such as those older adults or young children, may develop diseases such as pneumonia or bronchitis as a result of the flu. It is important to seek medical attention when developing shortness of breath, chest pain, severe weakness, pale mucosal membranes, or severe dehydration. In regards to the vaccine, the CDC recommends that people over the age of 6 months old obtain an annual influenza vaccine. Since the flu tends to spread in the colder months, it is recommended that individuals get the vaccine around the months of September or October. Those who are pregnant or plan to become pregnant during the flu season are recommended to get the vaccine as well. The vaccine is recommended due to its effect of decreasing the risk of getting the flu or complications of the flu, although the vaccine is not 100% in eliminating your chances of getting the flu itself. There are key ways that you can limit the spread of the influenza virus. Proper hand hygiene is the #1 way to eliminate the spread of disease. Appropriately washing your hands for at least 20 seconds or using hand sanitizer will help prevent common infections. It is important to cover your nose and mouth when coughing or sneezing, since the flu is spread through the air. Covering these areas will help prevent the spread. Other ways of avoiding spreading or contracting the flu are avoiding crowds, cleaning surfaces in your home or common spaces, and avoiding touching your face. Thank you.
Hi everyone, my name is Stephanie and I'll be talking about the importance of a healthcare proxy and their responsibilities. A healthcare proxy has been defined by the Massachusetts Medical Society as a legally valid document which allows you to name someone to make healthcare decisions on your behalf if you are unable to make or communicate those ideas. Having a healthcare proxy allows the healthcare team to understand what the patient's wishes are in regard to their health from the designated person to the patient chose to speak for them in case they are not able to make their own medical decisions. If a person is not appointed and a situation occurs where you cannot make a medical decision for yourself, state law will determine who will be prompted and make the decisions. It is never too early to start planning who your healthcare proxy will be. This person is usually someone you have a good relationship with, knows you and your medical history well, above the age of 18, and someone who's reliable and trustworthy. Some other important qualities are being able to make decisions in stressful situations and being available to talk and meet with healthcare providers. The role of a healthcare proxy not only allows decisions regarding your medical care, but they also get to choose a doctor who cares for you and who gets to perform your activities of daily living, such as bathing, getting dressed, and eating. Some things proxies cannot do are change a will, make decisions after a person passes away. It cannot give the responsibilities of decision making to someone else unless the other person who's assigned a healthcare proxy. Someone may be afraid to ask others to be their healthcare proxy or be wary to accept this role of being the decision maker. It's a very important role that can make life or health decisions. So you want to make sure that person is comfortable with it. If someone does not accept this position, it's important to discuss the types of treatment you wish to receive or not to receive, such as palliative care, life-sustaining care, or other treatments. Other things to discuss are your thoughts on additional help, such as home health care or skilled nursing facilities, religious and spiritual values, and personal beliefs towards health, illness, and death. Sometimes it is helpful to discuss your past medical experiences and any other conditions that can occur in the future. Some do this by having their proxy go to a doctor's appointment with them to get a better understanding of their medical history and how they want to be treated. Others like to write their thoughts down while discussing, so their healthcare proxy is stored away in a safe place. Overall, it is important for everyone to have their wishes granted when it comes to receiving medical care. Be sure to think and plan these wishes ahead of time and have a healthcare proxy form completed to be available when you want these wishes to be received. Thank you.